Welcome, everybody. Good evening. Thanks for joining us. This is UAB's Town Hall for graduate students and postdocs. I'm Rosie O'Byrne. I'm with University Relations, and I'm going to help moderate tonight's event. Thanks to all of you who sent in questions beforehand. We've shared that with leadership. And so they're going to try to answer some of those questions in some brief updates that they're going to give. So tonight, we're going to have some updates from Dr. Pam Benoit. She's our Senior Vice President for Academic Affairs and our Provost. Dean Lori McMahon, she's the Dean of the Graduate School. Dr. Lisa Schwabert, she's the Senior Associate Dean for Graduate and Postdoctoral Affairs. Dr. Michael Faircloth, he's the Director of the UAB Student Health Services. Dr. Angela Stowe, she's the Director of Student Counseling Services and Wellness and Promotion. And you'll also hear from Jasmine Benjamin. She's your President for the Graduate Student Government. So just to let everybody know, we are recording this session. And if you want to come back and look at it once again or share it with colleagues or friends, go and look for UAB's YouTube channel, and we will have it there posted after the event, probably tomorrow. And then after the updates, we'll go into Q&A, and so I will see you back then. I'll hand it off to Dr. Benoit.
Welcome. We're so glad that you could join us tonight. We know that this is a very stressful time, and you have a lot of questions, and we're hoping tonight to be able to answer a lot of the things that you're wondering about. I want to say that the things that are most important for us are health and safety of our students, and also ensuring that you are making good academic progress in your studies. And to that end, we've done a number of things on campus to ensure particularly health and safety for each of our graduate students and postdocs. So first of all, we are asking that all students take a COVID-19 training before they enter back into the campus. Secondly, we are requiring that all students who are coming back onto campus are tested for COVID-19 before entering the campus. We will ask and require that each of you complete health check at least every 3 days. Health check is an application that asks you about your symptoms. And so if you are having symptoms that are connected with COVID, you get referred over to student health so that they can follow up with you. We also will be doing sentinel testing. Sentinel testing, this is a new concept to me. What it is it randomizes people who are on campus to particularly see if we have some people who are positive or asymptomatic, that allows us to monitor very carefully the spread of COVID-19 on campus. In addition, we will be requiring masks on campus. So each student will be provided with 2 cloth masks that they can use. We will be doing socially distant activities, and we will be asking you to think very carefully about hand washing frequently. Those 3 things together are considered to be very important in trying to prevent the spread. In addition, in terms of your education, we've been thinking about different ways of offering courses to abide by socially distancing rules and to ensure that, again, you're making good progress. And Dean McMahon will pick up and talk a little bit about those different kinds of delivery modalities.
Good evening, everyone. I'm really thrilled to be here, and I'm thrilled to see so many graduate students and postdocs who have tuned in this evening. I just want to reiterate what Dr. White said about our health and safety. That is absolutely our first priority. And the leadership has been working tirelessly to make sure that our campus is the healthiest campus in the US. And so there's a lot of things in place, and we can address your questions related to that as we go through this evening. But I just wanted to share with you how thrilled I am to be the Dean of the Graduate School. And I really missing all of the students. I'm missing the postdocs, I miss seeing everyone on campus, and I look forward to the day where we're able to return to campus. And we've been able to take advantage of Zoom and with our discoveries in the making and our donuts with the dean, but it's still just not the same as seeing your smiling faces in person. So I want to try to address what your curriculum will look like. So there's been a lot of questions about what will my schedule look like. So there are 4 course modalities, and you will see this on your schedule. And the first is face-to-face, which is the traditional course that you would take. And if your class meets Monday, Wednesday, Friday, you will be in that class Monday, Wednesday, Friday, and you'll be in a space where you can socially distance and wear your mask. There's hybrid, which is a combination of being in person, face-to-face, and engaging remotely. And so in that kind of class, the enrollment will be split among the days of the week where the class should take place and you will participate, and that will be indicated on your schedule. There are also classes that are fully remote, and those are classes that were meant to be face-to-face, but the enrollment is too large for the space where the class is to be held. And so in that case, we have decided to offer that course in the fully remote mode. And then finally, there's the online course or the Q course. So these are the courses that were meant to be online and continue to be online. So we are really happy that the government just yesterday rescinded their policy. So we're thrilled for our international students. We were so concerned about all of you. And so yesterday afternoon, we could take a sigh of relief. So there is no issue with your enrollment. You can be enrolled in online classes with no penalty. And so David Hoffman will answer additional questions about that. So again, we are just thrilled to have you here. Those of you who cannot get to the US, we also are thrilled to have you enroll in the fall term. So, and I know that many of you have taken the training and the health check, and Dr. Benoit mentioned that. And I just want to reiterate how important it is for you to do the training, and you have to do the health check every 3 days. Now, some programs may ask you to do that more often, and if that's the case, then you will do that, but that's your part in keeping our campus safe. So doing that health check is really, really important. And I just wanted to address one other concern and question that's come up in the last day. So many of our clinical students returned in June, all throughout the month of June and in July. So clinical students such as nursing and physical therapy and dentistry, optometry. So all of those students signed an attestation where they were assuming risk of possible COVID exposure. So in those disciplines, these students interact with patients. And so we wanted to make sure that they were fully aware that they could be at increased risk of COVID exposure. We also know that this is true for our students and our postdocs who are engaged in laboratory and field research. There may be times when you want to learn how to use a microscope. There may be times when you need to collect samples with someone and you will temporarily not be 6 feet apart. And so we wanted to make sure that students that are in those kinds of disciplines that could experience a temporary infringement of that 6 feet, we also wanted those students to understand and attest to that possible risk. Now, in no way does an attestation force you to participate in something that you don't want to participate in, but this is just to make you aware that you could be at increased risk. And students always have a choice. They have a choice to continue their education, and if they're uncomfortable, then there's other options, such as a leave of absence or asking for accommodations. So those questions came up in the last 24 hours, so I wanted to address that. So we're working on a little bit of different language, and so we will communicate that in the next coming days. And so this attestation of risk for research will apply to all of those students who are engaged in laboratory or field research, including postdocs, and will also include undergraduates and masters. So I'm going to stop with my comments there. And again, I'm thrilled to be here with you this evening, and thank you for tuning in. So I'm going to pass it to Dr. Schwiebert.
Terrific. Thanks, Lori. I too am so excited to be here and to be chatting with all of the postdocs as well as graduate students, of course. And let me just echo my welcome and thanks, particularly to the postdocs who are joining tonight. And again, echo our concerns for your health and safety. That is the overriding goal for us to make sure that you are meeting those career goals and working toward those goals as you can. So excited to work with the Postdoc Association as well as our newly formed Black Postdoc Association. Couldn't be more excited to be working with both of those groups toward these ends. And just, real quick, I know we have usually many in-person events, and I so miss those, seeing you and interacting and networking with you all. But I know that we're going to get back to those soon. In the meantime, be on the lookout for our virtual events as they come forward, particularly for the Postdoc Appreciation Week that we are now in brainstorming planning for September. But let me just conclude real quick to say that I look forward to your concerns and answering your questions. To echo the concerns that we too have heard with regard to the attestation form, I would like to really the opportunity to help clarify any of those questions that you may have. So at this point, I think I will now pass it on to Dr. Michael Faircloth in Student Health.
Thank you. Welcome. I am Mike Faircloth, the Medical and Lab Director for and a physician within UAB Student Health Services. I am honored to be one of the trusted voices for the health and safety of you, our UAB students, and also understand my unique privilege to provide care for you as well. I am fortunate to have been asked to participate on and continue to serve several health and safety task forces and committees, both at the UA system and UAB campus levels. Since the beginning of this pandemic, it's been very clear that the UA system and the UAB institutional priority is the health and safety of its students, staff, faculty, and visitors. The mandates from UA system Chancellor Finus St. John and UAB President Ray Watts to set the standard for health and safety, and from Dr. Selwyn Vickers, Senior Vice President of Medicine and Dean of the UAB School of Medicine, to develop a plan grounded in evidence-based science and medicine, have informed the decision-making and recommendations at every step of this process. SARS-CoV-2, the virus that causes COVID-19 illness, is a new virus, but the public health principles that define how a community and individuals can most effectively respond to this challenge are not new. They are time-honored and grounded in that evidence base mentioned above. The resulting recommendations and plans align with these principles and apply to all students, faculty, and staff, helping to facilitate a safe return to campus. And these include, as mentioned earlier, required education about COVID-19 itself and about the protocols being implemented, initial and ongoing symptom and exposure monitoring, daily to every 3 days, sentinel testing, which again is the systematic random testing of a percentage of all on-campus students and staff on a weekly basis, which will allow us to define the background asymptomatic positivity rate and identify early trends and other data related to the virus so that we can promptly act as appropriate. And this started last week. Also, mandatory entry testing moving forward prior to return to campus for all students who will be on campus for any period of time this fall. Both sentinel and entry testing are provided at no cost to you, the student, as the UA system and UAB are working with the state of Alabama to provide this testing at no cost, and we are grateful for that opportunity. Some of the basic critical mitigation requirements and measures include social physical distancing, mandatory masking as mentioned earlier, and every student will get 2 disposable or reusable cloth masks, proper hand hygiene, remaining off campus if you feel sick, and identifying those who are sick, positive for COVID-19, or have had a significant exposure to those with COVID-19, and quickly isolating and quarantining to prevent spread of the virus. Again, these are sound public health principles, and when followed diligently, as is required and expected on the UAB campus, they are effective measures to mitigate exposure to and potential illness from COVID-19. We are fortunate to have many regarding COVID-19 renowned experts in medicine and public health right here on the UAB campus. And their expertise and guidance have been and continue to be critical to the decision-making process, ensuring that the UA system and UAB leadership are best prepared with meaningful and current data. The pandemic is fluid and knowledge is rapidly evolving. And as the return to campus plans need refining and updating, this will be accomplished in a timely and effective manner. There's no such thing as no or zero risk. But with the things that I've talked about, the outline planning, the protocols, experts that we have guidance from, it's clear that the UAB campus is absolutely actively working to provide the safest campus in America. Student Health Services is open to serve all of our students, both on-site, in person, and virtually through video visits, and we will continue to be available throughout this entire challenging time. Thank you so much. I will turn it over now to Dr. Angela Stowe.
Good evening, everybody, and I'm so glad to be here and be a part of this panel. And I think I just want to speak to the fact that you are important and you matter and we care about you, and that's the reason why we have some time tonight to talk about mental health. UAB has just launched an enterprise-wide initiative called UAB Cares, because we want to make sure that no matter who you are, that you know that we're here to support you and there are services available for you. So I want to talk a little bit about what's available for students. Next slide, please. At the UAB Cares website, you can see a lot of specific resources to get you connected quickly if there is services that you need related to a crisis or a mental health concern. So we want to direct you there to those resources. We also have our department on campus that's offering distance counseling services currently and has been the entire time that we have been working remotely through the limited business plan, and then we will continue to be offering our distance counseling appointments through the fall. These are offered through Zoom, video, or phone. We continue to have our counseling hours available Monday through Friday, 8 to 5, and services are free to enrolled students, and this includes graduate and professional students. If you're a postdoctoral fellow, then you'll be able to receive services through the Employee Assistance and Counseling Center. So I want to make sure that that's clear. Services are confidential, and that information is not put anywhere with a student record or anywhere that someone would be able to access outside of student counseling services. Appointments for the first time are able to be web booked through your patient portal, and you can access that on our website. Next slide. There is 24/7 support available through a few resources that are important. The National Crisis Text Line, you can text UAB to 741-741. We always refer folks to the Suicide Prevention Lifeline, which is a really great resource to have available 24/7. Then there's also an emotional support helpline for COVID-19 that's available 24/7 as well. We want to help you know how to help yourself as well as help others. There are 2 online platforms that students are able to access and use. TAL will help folks with things like stress and anxiety as well as mindfulness modules. And then Cognito is a resource to help train you on how to help others. So if you're worried about someone or you want to know how to have a conversation to assist someone in getting support that they need, Cognito can help guide you through those skills. And we want to stay connected to you in other ways as well while we're all working remotely and looking at how we're going to transition back to campus. The mental health ambassadors are students that are offering daily programs online and through their social media platforms and through Zoom. They also have those recorded on YouTube, and they have posts that they provide as well through Facebook and Instagram. We have a weekly podcast called Let's Talk About It that's hosted by Herbert Wilkerson, one of our counselors, and those drop every Tuesday afternoon at 4:30. And Herbert has conversations with people all over campus, and right now really focusing on coping and what it's like to take care of yourself during COVID-19 and the pandemic. And then please follow us on our social media on Facebook and Instagram so that you can know what's available to you, but also have some tips and helpful advice on how to take care of yourself right now. And then my final note is just some information about self-care and some highlights and reminders that right now it's really important to be vigilant about your self-care. There's a lot going on, and it's a stressful time to be a graduate student and a postdoctoral fellow. There's a lot of uncertainty and a lot that you're managing and working through. So some things you can do is set a routine and be sure to be mindful about breaks during the day and setting boundaries when you can so that you can have some time to step away. Be kind to yourself and others. It's really important now that we practice self-compassion. It's easy to be hard on yourself, to beat up on yourself, and to think that you should be doing it differently or better than you are, but practice self-compassion. That's super important for your mental health and well-being. Be mindful of sleep, nutrition, and movement, and taking care of those basic needs of yourself, but also be gentle on yourself if maybe you're not exercising to the level that you think you should, or you're not eating the healthy meals that you think you should. You're doing the best that you can. So be gentle on yourself and just get up the next day and try to do it differently if you need to. And then just remember to do something outside of your research and your work. Think about ways that you can be creative, things that you can learn to work different parts of your brain. Maybe you can serve, or you can find ways to connect with people outside of your maybe home environment or usual work environment. Next slide. And then just please know that you matter, you are important, and you are not alone, and that everyone that is speaking tonight and everyone else that is here tonight, we really are here for you, and we care about your total person and your whole person, and we know that there's a lot going on, and that we want to make sure we get through this together. So thank you. And now I'm going to pass it to Jasmine Benjamin, the president of the Graduate Student Government Association.
Thank you, Dr. Stowe. Thank you for having me tonight. And I hope that everyone's doing well and being safe, taking the appropriate precautions. I know that this is a very interesting time to be any kind of student, but particularly a graduate student or a postdoc. I know that a lot of us are feeling a lot of anxiety and a lot of eagerness, perhaps, about going back to campus, but rest assured that we are working behind the scenes to try to make things as safe as we can for everyone that's coming back, whether that's in a research capacity or simply going back to the classroom. As Dr. Benoit said, we're providing things like masks and other forms of PPE. There will be plenty of places for you to wash your hands and use hand sanitizer. We also have, if you haven't been in any of our buildings lately, decals on the floor to remind you to stay 6 feet away from each other. And a lot of our halls are one way now, which cuts down on my anxiety a whole lot about coming face to face with someone else. I admittedly am not sure about how much I really have to offer on this panel. Usually when you all do send your questions to me, I direct them to someone else that's on this panel. But I am definitely here to field any questions that I can. And if there's anything that any of the graduate students come up with later, whether that's a question or a concern or a comment, please feel free to send me an email. My name is the same as my name on my little Zoom square. And you can also send us a general email at uab.edu/GSG. Thank you.
Great, thank you so much. So we're going to open this up to Q&A. So if you have a question, please feel free to submit that in the Q&A section of the Zoom room. Many of you sent in questions yesterday or the day before yesterday, and so we've compiled those, and so I've got that list, and I'm going to start there first. We had a lot of questions come in about the status of international students, in which already Dr. McMahon has spoken about a bit, and we see that I see Catherine Crow on this call, and she's answering some of the specifics in the Q&A, but I thought it'd be important maybe to give some time to both Catherine and to David Hoffman, who could speak to just the latest with international status. So Catherine, would you like to go first?
Sure. Good evening. I'm so glad that so many of you could join the call. And like Dr. McMahon said, I, for one, heaved the loudest sigh of relief yesterday when we found out that the court has decided not to put in place any of the rules that SEVP issued last Monday. So all of that big announcement that came out about having to return home if we went online and not being able to enroll in certain numbers of online classes, that has all been rescinded. It's not going to be enforced as of yesterday. So as I'm sure you've seen, things change quickly. We can't promise they won't change again, but right now we're in a very positive space and very confident about UAB's hybrid operational model for fall. I've been answering the questions in the chat and providing a link to a helpful FAQ page on the International Student and Scholar Services website, where we will constantly update if there's breaking news about that. But right now, the bottom line is, you are welcome here. You can enroll in all of our classes, and we're committed to helping you find ways to get here. David, do you have anything to add?
No, we work very closely with Catherine and her team in ISSS. We do mostly everything on the working with the graduate school on the enrollment side. So processing your application, your paperwork, working with the graduate school on your admission and the departments. And then Catherine helps on the immigration and document side. So we work very closely, hand in hand. And so whatever questions you have, shoot them our way. We'll get your answers.
Okay, a student asked, I'm an international student admitted for fall 2020. I receive a Blazer Fellowship for my PhD program in materials engineering. Because all the embassies are still closed, I have to defer my admission for spring 2020 or, sorry, this question is cut off for me. I'm wondering if I could have my fellowship for spring 21 and for fall 21. Also, I want to have online classes. If I want to have online classes in fall 2020, should I pay any tuition since I do not have a visa yet? Kind of a complicated question there, but.
I'm happy to get that started.
Okay.
So we absolutely want you here as soon as you can get here, and we will hold your Blazer Fellowship until you can get here for spring 2021. So we look forward to you joining us on our campus when you can get here. And so don't worry about your Blazer Fellowship. We will keep track of that and we will hold that for you. So, and to answer your question about the fall, so I will suggest to you that you reach out to your program director. So many of the programs will want students to take courses online if they can for the fall, and we are working through the process to see if we can offer tuition scholarships to those students, so stay tuned for that. But I think that the best information that you can get is working directly with your program director to understand which classes you should take, whether it might be best for you to wait to start your curriculum in the spring 2021 semester. So if you have questions, you can always reach out to the graduate school. Jesse Kepley, who you see here tonight, he's the Director of Student Academic Services, so he's happy to help you, and so is David Hoffman and Catherine Crow. So just hang on, and hopefully we will see you in the US and in Birmingham in January.
Student asks, can I defer my application to spring 21 as the visa embassies and consulate offices in India are not open and I don't want to take online classes?
Yeah, I would be happy to address the deferral question, and then Catherine or David can weigh in if there's any additional guidance with the student being international. But just speaking generally for deferrals, we're being as flexible as possible with those. So one of the common questions we've received is about deferring to the spring, and then what happens if I need to defer again for whatever reason? Because typically students are only permitted to defer once, and that's something we have waived, just given everything going on with COVID. So we are here to support students in a way that makes sense for your individual situation. So if that is what you need from a deferral standpoint, if that makes the most sense, go ahead and do that, and we'll work with you to get your application updated so that you're able to start whenever you're able to get here.
Great. Did anybody else wanted to weigh in? Okay. We've had a few questions surrounding testing. So given the number of students who would return, does UAB have the capacity for all the potential tests and getting the testing results back in time? So Dr. Faircloth and Dr. McMahon.
Yeah, I would say we're actively working with partners to have that capacity both for the testing and the processes for receiving those results and the necessary actions after that. So yes, by the time that it's necessary to do that, we should have that capacity.
And then a follow-up question, if we, a couple of people have asked this, if we have recently had a test for SARS-CoV-2, AB and qPCR, and have come back negative for both, will we still need to get another test? Dr. Faircloth.
So the negative test needs to be within 14 days of entry to campus.
Okay. Continuing with the testing questions, will we be able to get COVID-19 testing if our classes are all online? What about online out-of-state students? Dr. McMahon?
So online out-of-state students are not required to have the COVID-19 test, so you are exempt from that.
Okay. To student life, are there student orientation leaders who can assist me in securing an apartment off campus? I don't know if there's anybody that can answer that here.
Sure, let me respond to that. My name is John Jones. I'm the Vice President of Student Affairs. First, let me say it's an honor to be a part of this panel, and certainly thank you, graduate and professional students, for joining us in this town hall. We do have a department under Student Affairs. It's called Off-Campus Student Services. And if you do a Google search, UAB Off-Campus Student Services, that office will show up in that search. Within that webpage, there's a off-campus housing search feature where you can search for apartments. In fact, you can even narrow your search if you want to put in the number of bedrooms or the price point and things of that sort. So again, Off-Campus Student Services webpage, the point of contact, if you want to name, Dory Weldon.
Great, thank you so much. So we have a few questions that came in specific to research. So regarding university decisions to reopen in the fall, would your own IRB approve human subjects to be exposed to this risk? So, Dr. Brown.
Thank you. And my name is Chris Brown. I'm the Vice President for Research. Let me say I'm also pleased to be a part of this panel to share about research. And of course, we recognize, and it's widely recognized, that graduate students and postdocs are a key, maybe a very key part of the research endeavor at UAB. We have developed a series of guidelines on the safe conduct of research and what it takes to come back to research. And each individual investigator or research leader needs to have an approved operational plan. And that's for their space and their overall work. If there are individual IRB plans, those are specific to the project at hand, and they are vetted very carefully by our Office of the IRB and the Institutional Research Board itself. So our effort is to conduct research as safely as possible. Also, and I saw it was earlier, you can go to the UAB reentry webpage and find a series of these. You can find these guidelines. You can also find a evolving or IRBs or human subjects research or any number of issues related to our resumption of research.
And just to follow up on that with research, Chris, can IRB provide information regarding considerations about conducting qualitative research virtually or online? For example, in the event UAB goes fully online prior to Thanksgiving and or the state shuts down non-essential businesses. This would be helpful, especially if graduate students already have IRB approval for face-to-face interactions with participants, for example, focus groups and interviews.
So any research involving human subjects requires an approved IRB. And that's not really the question, but I just want to state that. With regards to activities, whether it's, and in this case, research that can be done remotely, that is not on campus, that's encouraged. Please continue with that. You don't have to come into campus. You can do the surveys, do the interviews with human subjects. So remote, we'll call it remote work, is encouraged. And if this is key that you connect very closely with, ensure that you are part of their operational research plan. Part of each operational research plan is to list the people that can come back and how people are going to come back or remain remote and effectively do their work.
Okay, thank you so much.
Could I add one more point there? So I'm a qualitative researcher, and a lot of the work that I've done involved participant interviews. And in fact, Zoom is a wonderful program for allowing you to record those interviews so that you can transcribe them later. So I would say think creatively about ways in which you can accomplish your purposes that don't actually require face-to-face interaction with your potential participants.
Thank you, Dr. Benoit. We have a lot of questions surrounding kind of safety, so I think of students, so please feel free to jump in. Student is asking, as a busy professional working in healthcare and navigating processes for COVID-19, how do the graduate school plan to support professionals whom are working on the front lines but would like to further their education? Might need to repeat that. I think they're asking, yeah, go ahead.
Yeah, so I can answer that. We support all of our students, and if you're one of those working professionals, we want to support you, and we have mechanisms in place to allow students to take an incomplete if they need to. If something happens during the semester where a student gets sick or a family member gets sick, or if your workload increases because of your profession, we have ways to help you complete your work for the semester, and we stand ready for that. And so my recommendation is, if that happens during this semester and you need that extra support, your first place to interact are your instructors, the instructor of record, and then the second place is the grad school, and that's with Jesse Cupley. So we can manage that. So don't be afraid, and don't not continue your education because you're worried about those circumstances. We're ready. We're ready to help.
Lisa Kimbo asks, some of my classes are 2.5 hours. Sitting in the classroom with others for that long, even with social distancing and masks, it seems very risky. Is it worth holding these classes in person during the fall semester? Who would like to?
So I can jump in with that too, and then others can chime in. So health and safety is our #1 priority. It's in every decision that we make. It's in every action that we take. And so if you are in a class that meets for 2.5 hours consistently, then we will work through that with the instructor and get a plan in place where people are socially distanced, so that so that we can help mitigate risk, so that you're at the lowest risk that we can possibly be at with you taking those classes. Now, for your particular class, I don't know what the decision has been, if it's a face-to-face or a hybrid or a fully remote. So you will learn that when the schedules are completed, and if you have questions, you can just reach out.
Great, thank you. Student is asking, will there be any restrictions placed on out-of-state students coming from COVID-19 high-risk states, such as California or Florida? Dr. McMahon, or?
Yeah,
So
I can
take it too, yeah. Currently, the restrictions are for individuals who are coming from our state going to other states, as opposed to Alabama making restrictions. There are no travel restrictions in Alabama at this point in time.
Okay. A student is asking, is there any plan for protection on individuals on using UAB's bus system? We don't have anybody from transportation, but I think Dr. Benoit, you probably have heard other responses enough to respond.
So yes, and in fact, we've already implemented those for the summer. So we have reduced the number of people who can ride on each bus to allow for socially distanced participation on the bus. And you are required to wear a mask on the bus in order to be able to ride the bus. In addition, that means that fewer people can ride the bus at any given time. And so transportation has looked very carefully at those routes that did not have much activity and are planning to put more of the buses on those busy and active routes instead.
Thank you. Another student asked, what if students are part of a vulnerable group or go home to someone who is in a vulnerable group? Dr. McMahon, do you want to take that or point it to somebody?
Yeah, so I can start, and then maybe Dr. Faircloth can chime in. So we understand that students have their own health risks, and that students live with family members with health risks. And so there is a process for students to ask for accommodations in those cases. And so how you would go about doing that is reaching out to disability support services and working with them to get those accommodations in place. Dr. Faircloth, do you want to add?
Absolutely. And if that's also something that if you feel like you want to reach out to Student Health Services and let us and have a discussion with us, or even a virtual visit with us to discuss that, we're happy to do that, because each case is unique and we're happy to help in any way that we can.
Okay, so we had a few questions surrounding student life. A student, Sarah Riley, is asking, will the restaurants and bookstore be open for students on campus this fall? Dr. Jones?
I'll ask Pam to respond, or someone to respond about the bookstore. Certainly, I trust that it will be open, but I don't know the hours of operation. But the dining locations, we will be open, but there'll be limited options. Either you order online, or you pick up, or you be a grab and go type of setup or serving.
So I just was talking with the manager of the bookstore this week, and their plans are to have pickup that you can pick up at the curb, to provide socially distancing within the bookstore and limiting the number of people in the bookstore. So they do plan to be open, but they have designed different kinds of health and safety measures to ensure that students will be safe when they come to the bookstore.
Thank you. Several questions regarding tuition and fees. Will the cost of grad school be affected by what could likely become much more virtual learning experiences? And several people are asking, are there discounts or tuition reimbursements for altered classes? So Dr. Benoit?
So the answer to that is no. The tuition fees remain flat this year. Tuition is set by the Board of Trustees for all of the different institutions. And in fact, this may be surprising to you, but it's actually cost us quite a bit more in order to deliver instruction in a variety of formats so that you can continue your education. So there are no plans to alter the tuition structure.
Okay, thank you. A student asks, how do we pay for school and register for the fall classes? Who would like to take a stab at that?
So as far as registration goes, that really depends on your program. Typically, students are going to register after they're admitted. You will create your Blazer ID, which will allow you to log into BlazerNet and do all sorts of things, not just register, but also pay your bill, all kinds of other information that's handled via BlazerNet. So some programs do require a registration advising code, in which case you would receive that from your program before you're able to register. But in general, once you have your Blazer ID and resolve any holds, you'll be able to register in BlazerNet.
Great.
Cindy, can you talk about tuition, paying tuition? Cindy?
Sure. So the university accepts payment via credit card. So you'll, as Jesse mentioned, through that site called BlazerNet, you'll be able to pay your tuition. And there is, if you'd like to know when the dates are and how that's broken down, you can look on, it's a site called When to Pay, and it breaks down the amount you would need to pay, anytime any late fees may be applied and things like that. So it's a really nice breakdown of those requirements.
Okay. A student is asking, will all program orientations be held online?
Yes, all orientations are being held online. That's part of our process of keeping everyone safe. Once the semester starts, there may be small group interactions, socially distanced, and everybody again wears their mask with program directors. So those kinds of activities are program specific. I will mention that the graduate school, in partnership with the graduate student government, are developing an orientation for all graduate students. Jasmine, would you like to share about the orientation?
Yes. Let me make sure I get the date right before I So we are working with the graduate school to host an orientation. This will have some of the offices that we may work with as graduate students. So Title IX, campus rec, off-campus student services, things like that. It will be on, I'm not sure the date.
August 18th. It's August 18th.
Thank you. I now have that in my calendar. I need to add that. But it'll be August 18th, as Dr. McMahon said, and you'll get to learn from some of those different offices about what they can do for you as graduate students, how you can utilize them. And you'll also get to hear from quite a few of our student organizations in the event that you're looking for ways to get involved once you do either in person or virtually arrive to campus.
If I might jump in on that, and just to update everyone that our next postdoc orientation will be this fall, sometime in October. We've not yet set the date, but again, that too will be virtual and online. And similarly, we will provide information about benefits as well as resources available to postdocs as well.
Thank you. How do I know if my course has been switched from in-person to online? When will this be posted? Dr. Benoit?
So we're currently working with each one of the schools to designate whether or not a course is face-to-face, hybrid, remote, or online. We now have a number of those that have been turned in, but we have a few more to go. And we're currently in the process of putting them into the schedule. When that's complete, we'll be sending out a notice to students so that you know that you can check and see how each course will be delivered for the fall. It's an active process currently.
And also in academics, how will laboratory courses work for clinical laboratory students? I'll give that back to Dr. Benoit as well.
Actually, I think Lori might be a better person to answer that question since she runs the lab.
Yes, so really good question, really important question, and a lot of students have been asking about that. So, and I'll share that our faculty and our department chairs have been extremely creative in how they are developing their labs for the fall. And so students will be taking their labs, they will be socially distanced. Some, depending on the program, some programs have additional sections. You will see that reflected in your schedule. Some have adopted a hybrid format where some sessions will be in person and some will be simulations. And so I have to say I've been extremely impressed with the creativity of our faculty, and many of them have shared with me that they're more excited about their new plans. And so that's one of the silver linings, I think, of COVID. And it's really important for all of us. And when we're thinking about managing mental health, back to Dr. Stowe, looking for the silver linings. And so I think you will see that the faculty have been extremely creative and have figured out a way to have those classes that one might think would be impossible.
What accommodations is DSS providing for grad students with immune deficiencies and underlying conditions? Might punt that to Dr. McMahon.
Sure, the Disability Support Services is standing ready to help students. We know students and all of us can have a chronic illness that will put us at higher risk. So they are ready to help with accommodations, and these accommodations are specific. Each person will interact with DSS and a plan will be constructed. So it's on a person by person basis, and I encourage you to reach out to Disability Support Services as soon as you can to start having these conversations so you can plan your fall semester.
A student asks, what's the protocol if they test positive for COVID-19 during the semester? And then a follow-up, a student is asking, will there be a way for students to continue the class online given the long quarantine period? I think I'll start with Dr. Faircloth first, and if anybody else wants to weigh in.
Yeah, so on the health check, it's a symptom and exposure assessment. It also has in place that you've tested positive, or in addition to the symptoms and exposure. So if you're positive, first you need to go into health check, and you would put yes. You also can contact Student Health, and I encourage you to do both. Once we know that you're positive, then someone from Student Health in real time will reach back out to you to talk about your unique situation and decide what sort of isolation, depending on whether you're symptomatic or asymptomatic. and what that needs to look like and what we can do to help you achieve that.
And I think Dr. Pam Postian might be able to add about the course structure that helps students in this case.
Absolutely. So the students that are out with either being quarantined or have been diagnosed or having to care for someone who is in that situation would be able to join the course that they are registered in remotely, because our courses that are meeting face-to-face will have a live stream function so that you would be able to engage with the class and be able to participate real time with them.
Thank you. A student is asking, will we be forced to sign the assumption of risk form to continue our work at UAB? What is the penalty if we do not sign it? I think I'll hand that over to Dr. Brown and Dr. McMahon.
And I think Katie Crenshaw can address this too from a compliance standpoint. So I will just say that the assumption of risk attestation, and I'm guessing that this question is related to research. It's really important that all students and postdocs who plan to be on our campus and in our labs sign that assumption of risk attestation. I am fully aware that some of the language in that document is maybe a little bit hard to understand, and so we're working with the Office of Counsel to revise that. So stay tuned for a revised document that may be a little bit, like I said, easier to understand and be clearer, but the purpose, and so just let me address the purpose. It's to make sure that students know that there may be times in the course of their education, working in the laboratory, that social distancing at 6 feet may be violated. So if you are working on a new project and you need some training from either the faculty mentor or maybe a senior postdoc or student, there may be periodic times where that 6 feet will be violated. And if that happens, then that could increase your risk. But these are decisions that you as a student or a postdoc can make. And so that's what the assumption of risk attestation is about. So these are personal decisions and you can think through those, but it's in the discipline of research. If you are in a laboratory, it could be that you will have this situation where the 6 feet will not be met. So we are requiring that everyone who will be on our campus sign the assumption of risk attestation.
Lori, thank you. This is Katie Crenshaw, and I work in the Risk and Compliance Office here at UAB. Thank you for covering that. Yes, I really don't have anything to add aside from, yes, it is a choice, and we certainly want students to make an informed judgment about signing that assumption of risk document. It really is just an acknowledgement of the circumstances that they're working in, and we want to make sure that everybody is aware and takes personal responsibility for the precautions that we have in place, mask wearing, in addition to some of those other things that you mentioned.
So a student asks, what if students who have face-to-face classes are not social distancing when physically off campus, especially those who are being trusted to interact with patients?
So Katie, do you want to address that one too, from a compliance point of view?
Can you repeat that, Rosie?
Yeah, it's what if students, students are expressing concern that off campus, people may not be following the social distance rules, and how do we trust them?
Well, certainly as part of a community, what we are committed to, the Blazer Way, is looking out for each other here. And while on campus, we do have requirements in place that we believe will mitigate the risk of spread on campus. And that includes things, like I said, you've already heard about tonight: masking, distancing, keeping your hands washed, and being responsible as well off campus. Now, that's not something that's within our control here on campus, but we do acknowledge that we all have a personal responsibility to our community here, and we hope that everyone will fulfill that.
Rosie, I think it might be helpful for you to add to that question, because I know a lot of your work is aimed at that issue as well.
It is. I'm in communications and marketing, and we have kicked off a campaign called UAB United. hashtag UAB United. So this is really promoting all the safe practices that we have to engage in to keep ourselves safe and keep our community safe. And it does really, we do address doing all of these practices, whether you're on campus or off campus. And so we really need help with the messaging, and it's part of the uab.edu/reentry site. And then look in your green mail or communications from Central, and we are really promoting this campaign, and we've got a lot of fun social things that we're doing throughout the semester. We're going to have to make masks, wearing cool, and everybody needs to wear a mask. And so there are simple things that we need to do, but I think we can support each other by supporting the messaging that we're trying to get out. So be on the lookout for hashtag UAB United. We appreciate everybody participating in that. So we have time for, actually it's near our 7 o'clock hour. So I'd like to just hand it off to Dr. McMahon for some closing remarks, and to Dr. Benoit for some closing remarks.
Great. It's really been a pleasure to be here this evening. And I just want to reiterate that we are thrilled that you have chosen UAB for your training, for your graduate training, your postdoc training. It's a privilege for us to have you here, and we are working really hard to make sure your experience is fantastic, even during COVID times. So we are ready to be flexible. We're ready to support you. We want to help you continue your education. That's our goal, is to help you get the education that you are seeking. So we stand ready. We look forward to interacting with you. And I just will suggest to all of you to stay safe, wear your mask, wash your hands, and socially distance, and go Blazers.
Dr. Benoit.
So I would say, first of all, you asked great questions today, and we're really glad that we could address many of them. Those that didn't get addressed today, we will address, and so watch for them in green mail. I want to thank all of you for coming. I want to thank all the panelists. I think one of the things that you can conclude from the discussion we've just had is that there's an extraordinary amount of effort and planning going into providing a very safe campus for you to return to in the fall. So we, again, are incredibly excited to get a fall semester off and to work very closely with you in the future. Thank you so much for coming tonight.
Thank you. Good night.